Hello, friends. Did you know there is a strict 6-month deadline hidden in your Medicare enrollment that, if missed, gives private insurance companies the legal right to deny you healthcare coverage for the rest of your life? Most seniors think they can just buy a Medicare supplement plan whenever they get sick. That is a catastrophic mistake. Today, I am exposing the Medigap open enrollment trap, how medical underwriting can bankrupt your retirement, and the exact steps to lock in your guaranteed coverage before the window slams shut forever. To be clear right up front, this isn't a new government mandate or a stimulus check. This is the official federal Medicare enrollment rule that determines if you can be denied supplemental health insurance. Make sure you stay until the end, because even if you completely missed your deadline years ago and have pre-existing conditions, there are specific states with a hidden birthday rule loophole that forces companies to accept you anyway. I will reveal if your state is on that list. The rules around your retirement change every year. The government never explains your options. Subscribers find out in time. The others find out after the money is gone. Take a second and subscribe to the channel right now. Anyone turning 65 and enrolling in Medicare Part B, or older seniors enrolling in Part B for the first time, must face the hidden 6-month trigger clock. The Medigap open enrollment period lasts for exactly 6 months. It begins on the first day of the month in which you are both 65 or older and officially enrolled in Medicare Part B. During this exact window, you hold what federal law calls guaranteed issue rights. This protection means an insurance company cannot refuse to sell you any Medigap policy they offer. They cannot charge you a single penny more because of health problems, surgeries, or medications. You have to track this deadline yourself because nobody at Medicare is going to send you a warning text before it expires. First, locate your red, white, and blue Medicare card. Second, look at the lower right corner for the label that says Part B effective date. Third, write down the first day of that exact month. Fourth, count forward exactly 6 months on a calendar. That specific calendar date is the day your federal protection permanently expires. Fifth, apply for your Medigap plan, such as Plan G or Plan N, at least 30 days before that 6-month window closes to ensure the paperwork is fully processed. Look at Thomas from Ohio. Thomas turned 65 on March 15th, and his Part B coverage officially started on March 1st. His 6-month window triggered immediately on March 1st and permanently closed on August 31st. During that window, Thomas locked in a standard Medigap Plan G for $150 a month. His neighbor, who turned 65 at the same time but missed the window, had high blood pressure and waited to apply until September. The insurance company used medical underwriting to review his history and hiked the neighbor's premium to $350 a month. That $200 a month penalty costs $2,400 a year. Over a 15-year retirement, missing that 6-month deadline cost the neighbor $36,000 in extra premiums for the exact same coverage. Your situation changes how this clock triggers. If you are a senior who gets Part B exactly at age 65, your 6-month window starts immediately, and you get one shot. But if you are a senior who is disabled and received Medicare early at age 60, the law gives you a second chance. You get a second full 6-month Medigap open enrollment window the exact month you turn 65, completely resetting your federal rights. But what exactly happens behind the scenes if you apply on month 7? You fall directly into the terrifying trap of medical underwriting. This trap catches seniors who missed their initial 6-month Medigap open enrollment window and now want to buy a policy because their health is failing. If you apply for Medigap after that 6-month window has slammed shut, federal law drops your protections. Insurance companies are allowed to use medical underwriting. They can review your entire medical history, check your prescription records, charge you exorbitant premiums based on your health risks, or flat out deny you coverage entirely. If they deny you, you are left paying original Medicare's uncapped 20% Part B coinsurance completely out of your own pocket. If you are stuck outside the window, here is how you must proceed. First, request the medical underwriting questionnaire from an independent insurance broker. Second, carefully review the knockout questions on the application, which look for recent heart attacks, cancer treatments, or diabetes with severe complications. Third, gather your medical records to ensure your dates are accurate. Fourth, apply through an independent broker who can submit your application to multiple carriers at once, because underwriting strictness varies wildly by company. Look at Barbara from Texas. Barbara missed her window because she thought she was perfectly healthy at 65 and didn't want to spend money on supplemental insurance. But at age 68, she needed a sudden knee replacement and tried to buy a Medigap plan to cover the costs. She was denied outright by the carrier due to her underlying arthritis. The surgery and the subsequent physical therapy cost a total of $40,000 under Medicare Part B. Without a Medigap policy to cover the 20% coinsurance, Barbara was hit with an $8,000 bill, completely out of pocket. If she had been inside her window and secured Medigap Plan G, she would have only paid the 2026 Part B deductible of $283. The plan would have legally covered the remaining $7,717. Over 5 years of ongoing orthopedic care, that single denial cost her tens of thousands. The underwriting process splits seniors into two brutal categories. Passing medical underwriting means you get a policy, but you are usually forced to pay a higher, non-preferred rate for life. Failing medical underwriting means you are denied entirely, leaving your life savings exposed to infinite 20% coinsurance risk every time you visit a doctor or hospital. If you are approaching 65 and still working, there is a completely legal federal loophole you can use to pause this 6-month clock before it even starts, which means you have to understand how to handle employer insurance. This workaround applies directly to seniors age 65 or older who are still working and have active health coverage through their own or their spouse's current employer. You are not forced to take Part B at 65 if you have creditable employer coverage from a company with 20 or more employees. By delaying your Part B enrollment, you completely delay the start of your 6-month Medigap open enrollment period until the exact month you finally retire and activate Part B. First, verify with your Human Resources Department that your employer health plan is considered creditable coverage and that the company has 20 or more employees. Second, when you turn 65, enroll in premium-free Part A, but explicitly decline Part B on your application. Third, 2 months before you plan to retire, submit IRS Form CMS-L564, which is the Request for Employment Information, to the Social Security Administration to prove you had continuous coverage. Fourth, enroll in Part B. Your 6-month Medigap window triggers the exact day your new Part B coverage goes live. Look at Robert from Michigan. Robert worked until he was 68. He kept his company health insurance and delayed Part B. When he retired at 68, his Part B went active on January 1st. By delaying Part B, Robert avoided paying the 2026 Part B premium of $202.90 a month for 3 years, saving him $7,304. More importantly, his 6-month Medigap window opened at age 68, allowing him to buy a Plan G with guaranteed issue, avoiding underwriting completely despite having developed diabetes at age 66. The size of your company determines your rights. If your employer has 20 or more employees, Medicare pays secondary, and you can safely delay Part B. But if your employer has fewer than 20 employees, Medicare pays primary. You must enroll in Part B at 65 or face lifetime late penalties and completely miss your Medigap window. Even if you apply during your guaranteed window, insurance companies have one sneaky trick they can use to delay your coverage if you aren't careful. This is the pre-existing condition waiting period trap. It targets seniors applying for Medigap during their 6-month open enrollment window who have pre-existing health conditions. Even with guaranteed issue rights, if you have a pre-existing condition that was treated or diagnosed within the 6 months before your coverage starts, the Medigap company can make you wait up to 6 months before they will cover out-of-pocket costs for that specific condition. The only way to stop them is to prove you had at least 6 months of continuous creditable coverage right before joining. First, keep the certificate of creditable coverage letter that your previous employer or insurance company mails to you when you leave their plan. Second, when applying for your Medigap policy, submit a physical copy of this certificate to your insurance agent. Third, insist that the carrier waives the pre-existing condition waiting period based on your continuous prior coverage. Linda from Arizona applied for Medigap Plan G during her open enrollment at 65. She had been treated for a heart condition 3 months prior. She provided her letter showing she had continuous employer coverage for the past 10 years. Because she provided the proof, the insurance company was legally forced to waive the 6-month waiting period. When she had a $20,000 heart procedure in her 2nd month of Medigap, the plan immediately paid the $3,717 coinsurance after she met her $283 Part B deductible. Without that letter, she would have paid that $3,700 entirely out of pocket because of the waiting period. The gap on your calendar determines your coverage. If you have a 63-day gap or longer in coverage before buying Medigap, the insurance company can legally impose the 6-month waiting period for your pre-existing condition. If you have no gap in coverage, the waiting period is completely waived. What if you decided to try a Medicare Advantage plan instead of Medigap, but you hate it? The government gives you exactly one get-out-of-jail-free card. This is the 12-month trial right. It helps seniors who joined a Medicare Advantage Part C plan when they first became eligible for Medicare at 65, but now want to switch to Original Medicare and Medigap. The federal government offers a trial right. If you join a Medicare Advantage plan when you first become eligible at age 65, you have a 12-month window to change your mind. If you drop the Advantage plan and switch back to Original Medicare within that first year, you earn a special guaranteed issue right to buy any Medigap policy sold in your state without a single medical question. First, track the exact date your Medicare Advantage plan started. Second, if you are unhappy with the network restrictions or high copays, act before the 365th day. Third, call 1-800-MEDICARE to disenroll from the Advantage plan. Fourth, immediately apply for a Medigap plan, citing your trial right to bypass medical underwriting. James from Florida joined an Advantage plan at 65 because of the $0 premium. After 8 months, he got cancer and realized the network would not let him see the top specialist in his state. He used his trial right in month 9 to drop the Advantage plan and buy a Medigap Plan G. The Advantage plan had an out-of-pocket maximum of $8,850 a year. By switching back to Original Medicare and Medigap Plan G, his maximum medical exposure dropped to just the $283 annual Part B deductible, plus his monthly Medigap premiums, which came to $1,800 a year. Over a 3-year cancer fight, he saved over $20,000 in out-of-pocket maximums. The date on the calendar dictates your protection. Disenrolling at month 11 means the trial right applies and your guaranteed issue is granted. Disenrolling at month 13 means your trial right has expired. You must pass medical underwriting to get Medigap, which will likely result in an immediate denial due to the cancer diagnosis. But there is another special circumstance where the government forces insurance companies to give you a Medigap plan, even if you are 80 years old and sick, which is why you must know how to handle a plan closure if you want to protect your savings and find out how to handle sudden changes. This situation applies to seniors whose current Medicare Advantage plan or employer retiree plan suddenly drops them or leaves their service area entirely. If your Medicare Advantage plan stops providing care in your zip code, or if your employer-sponsored retiree health plan abruptly terminates your coverage, you trigger a special guaranteed issue right. You have 63 days from the date your coverage ends to buy Medigap plans A, B, D, G, K, or L without answering a single medical underwriting question. First, keep the official notice of creditable coverage or termination letter that your plan provider mails to you. Second, circle the exact date your coverage will end. Third, recognize your window. You have a timeline starting 60 days before your coverage ends and ending exactly 63 days after your coverage ends to submit a Medigap application. Fourth, attach that termination letter to your application as legal proof to force compliance. William from Nevada is 75. His former employer filed for bankruptcy and terminated the retiree health plan that William had relied on for 10 years. William received the termination notice on October 1st, effective December 31st. He used his special guaranteed issue right in November to buy Medigap Plan G for $200 a month. Because he had the physical letter, they could not underwrite his history of strokes. Without this 63-day protection, he would have been denied entirely due to his health history, leaving him exposed to a potential $50,000 hospital bill the next time he had a stroke, which would have cost him $10,000 in 20% coinsurance. Your timing will make or break your approval. Applying 30 days after the plan drops you means you are approved automatically. Applying 65 days after the plan drops you means you missed the 63-day window by 2 days. Your guaranteed issue is permanently lost, and you must pass underwriting. Now, for the payoff. If you completely missed your 6-month window, you missed your trial right, and your plan didn't drop you, there is still one massive state-level loophole that can save you. This helps seniors living in specific consumer protection states who are trapped in expensive Medigap plans or want to switch without underwriting. While the federal baseline is one strict 6-month window, insurance is regulated at the state level. Several states, including California, Oregon, Idaho, Nevada, Illinois, Maryland, New York, Connecticut, Massachusetts, and Maine have enacted continuous open enrollment or annual birthday or anniversary rules. These rules legally force Medigap companies to let you switch to a plan of equal or lesser benefit once a year around your birthday, with zero medical underwriting. First, verify your state's exact rule. For example, California allows switching 30 days before and 60 days after your birthday. Second, compare your current Medigap premium with competitors offering the exact same letter plan. Third, submit your application during your birthday window, explicitly citing the state birthday rule to bypass the medical history questionnaire. Patricia from California bought a Medigap Plan F at age 65 for $180 a month. By age 78, her premium had skyrocketed to $400 a month because her specific insurance pool got older and sicker. She could not switch normally because she had survived breast cancer at age 75, and companies would deny her. Patricia used the California birthday rule. 10 days after her 7800th day, or rather her 78th birthday, she applied for a Medigap Plan G with a competing company for $220 a month. They legally had to accept her. She saved $180 a month, which is $2,160 a year. Over her remaining 10 years of retirement, this single birthday loophole saved her $21,600. Where you live changes everything. Living in New York or Connecticut means Medigap is continuous guaranteed issue all year round, regardless of age or health. Living in Texas or Florida means no birthday rule exists. If you want to switch plans after your initial 6 months, you must pass strict medical underwriting every single time. Let me bring this all together. Locate your Medicare card and track your Part B effective date. If you are past your 6-month window, check your medical history or look for a state loophole like the birthday rule to see if you can still qualify. Your Medigap open enrollment period is a one-time, 6-month golden ticket that legally forces insurance companies to cover you regardless of your health. Miss it, and you hand them the power to deny you coverage or drain your bank account for the rest of your life.